So we're going to start with lay of the land here. This needs to be updated, but we have reps in every region of Texas. Okay, so here's just a quick slide on our market. And Craig Damaraki runs all of our sales company nationwide. Kylie Everhart was recently promoted. If you know Kylie, she has been promoted from Director of Sales Texas to over Missouri, Oklahoma, and Texas sales. And then we've divided up our the state. Obviously, everybody on here knows how big Texas is. And so Sabin Lopez and Sonia Porras have basically taken over management of all individual plans for the state of Texas. And then Johnny Sines and Tommy Dorsey are still reps in two different regions there. And then I oversee all still, and that will be statewide. And the only reason I say this is if you are looking for help on the individual side, I'm not the girl to contact. But I can point you in the right direction. But my baby is the small group stuff. So feel free to send all that to me and vice versa. They will not be able to help you with those small group stuff other than point you back to me. For just a little frame of reference on Friday Health Plans. So those of you who know this already know, but those of you who are new, we were founded in 2015 in Colorado. We are headquartered in Denver. And we were basically built when the ACA came around to just really make it, purchasing health simple, affordable. We all know insurance is already far too complicated. And I know there's a lot of companies and we're all trying our best to make this a little bit easier. Consumer. And so we developed our individual line first. We bought a health plan company called Colorado Choice. So they had, over almost 50 years running operations, more on the small group side. And then we bought that company and we scaled, and now we're in 7 states. And really the goal's been the same consistently. And I know the things that this is just kind of where I see, I'm fairly new to the company. I started in September, but one of the things that I've noticed since being at Friday Health Plans is that we really have a hometown feel. We care about our consumers, and on the small group side, we really care about the small guy. I've worked in the industry for a bit now in different companies, and one of the noticed is that our company really does care just as much about the small guy as a lot of our competitors care about the large guys. So small business to large businesses, right? So just keep that in mind when you're pitching Friday on the small group side. We really do care about, the small mom pop owners. We care about, the 5-person company, and we're going to be there for you and those clients in that way. So here's just kind of a map of where we're located. We started as Colorado, moved into Nevada, New Mexico, and Texas. Texas being our largest market still. We did move this January into Georgia, North Carolina, and Oklahoma. If you have licenses in any of these states and want to sell there, let me know. If you're in El Paso or some of these bordering cities, you definitely sell cross state lines, okay? Because our network does work, and we'll dive into network soon, but a lot of opportunity. We are moving into another 5 states for 2023. So we're scaling fairly quickly. When it comes to Texas specific, because that's the goal of this webinar, this is our, so unlike, some of the other guys, we do still have limitations on where a company can be located and where our network is. And so as we're growing this out here on the map, the purple counties is these on the right-hand side. So looking at the map only, these are the areas that we are in Texas right now. What that means is this is our service area. And although it looks scarce, it's actually not. I mean, these are the most populated areas of Texas, right? So you've got DFW, you've got Lubbock, El Paso, got San Antonio, the Houston area, the Rio Grande Valley, the Austin area. So we really have tried to go, where the people are, to say in the beginning. And as we're building this out, we're going to be scaling this out further into new counties. On the left-hand side, you'll notice the list. Okay, so Bear, Brazoria, Cameron, forth. The ones that you see listed in purple, these are the counties where we started. So we've been in the market for 2 years now. You see that we had a pretty massive expansion in blue counties, Brazoria, Cameron, Collin, and so forth. We've just basically grown our service area. So we are adding another 25-ish counties for 2020. So look forward to seeing those. And hopefully we'll be just able to really service more and more people. What does that mean for you selling the plan? Okay, so it has to do with eligibility. So in order for your client, a company, a small business to be eligible, the company has to be located in one of these counties. Okay, it can be in any counties, but the company has to be located in one of these counties in Texas. And then we do require that majority of the employees also reside in one of our services. Okay, so what that means is we allow for 30%. So 30-70 rules. So 70% of the employees of that company need to be in counties as well. They do not have to be in the same county that the company's domiciled in, but they do need to be in one of our service areas. What that means is 30% doesn't have to be. Okay, so 30% could live in California, Pennsylvania, or one of the gray counties here that we're not expanded into yet, and we would be able to write the business. Okay, we are a true small group, and so per TDI, a true small business in the state of Texas is going to be a company with 2 to 50 employees. So the company would have to have no more than 50 total employees for us to write it. Okay, and even if those employees are eligible or non-eligible, if you have 49 part-timers and 1 full, or I guess 51 part-timers and 2 full-timers, we wouldn't be able to write it, unfortunately. And that's because we do look at the employees. Okay. So let's talk a little bit about that 30%, because this is a pretty cool, unique thing that Frighting's offering. And, we're not a PPO, we're not an HMO, we're an EP. But with that, we do allow for there to be a national access program for the employees that are not in our service area. So what that looks like is that 30% of that are not in our service area, that do not live in one of those counties, would be able to enroll. They could be, again, in Texas, they could be outside of Texas. And their net is going to be dependent upon where they are. In the state of Texas, and if you want to take notes on this, in the state of Texas, our network is Health Smart. So reside in one of our areas and have access to the Friday Health Plan Network, you're going to be accessing the Health Smart Network. Okay. If you're in another state, it could be SPHCS extended PPO. If you're in California, for example, I always show this. If you're in California and plug in the information, it's going to populate First Health. So First Health is the network. Okay, so instead of accessing the Friday Health Network that we don't have there in California yet, they would have access to the First Health Network. And this also applies to independents like college students. So, I have a colleague that her daughter lives in College Station area, going to school at Texas A&M, and she is on the Health Smart Network. So she carries another card, and I'm going to show you kind of what that looks like. But just know that we have something for everybody. Okay, so don't be afraid if you've got a company that has some remotes. That's very common right now. How you would locate the network. So obviously, if they're going to be within our service area, they're going to have to be on the Friday Health Plan Network. Access that through our website. And if you haven't done that yet, I'm happy to show you. But if they are in one of these other areas, you would just go to the access program kind of instructional page, and you would just type in the address of the employee or dependent, and it would just populate exactly what network and then the providers available in their area. So very simple. Anytime we send a quote out, or if you pull your quotes, we always send this along as well. And it's just kind of how do you start looking up providers, in different areas. Let's talk a little bit about so our plans are EPO, as I mentioned that earlier. So what that means is they're not HMOs and they're not PPOs. They're kind of what is considered a hybrid in between. So unlike an HMO, there's no referrals needed to see a specialist. Okay, so you don't have to go to your PCP and then see a specialist to pay the copays in between. As long as they're in our network, you can go see anyone. We also don't require that you elect a PCP when you're enrolling in coverage. And then unlike a PPO, you don't have any out-of-network benefits with our plans. Okay, so other than emergency care, which if you have an emergency, you go to the nearest hospital and it would be covered at in-network. But there's not any out-of-network benefits at a different price, right? So we do encourage people to, if you're traveling or those sorts of kind of virtual options, but there aren't any out-of-network benefits, okay, other than emergency care, which per the ACA are required to offer, and we do. We are fully insured, so we're not a level funded plan. We're not an indemnity. We are fully insured, guaranteed underwriting. So no questionnaires, because this is a small group product. It is guaranteed issue. So no matter what kind of claim status, no matter what happened with the level fund, we would be able to enroll them if they met the other criterion on size and location and so forth. Okay. The cool thing about that, I'll just mention, I mean, I know level funded is a big thing right now, and I know a lot of people are trying to figure out, affordable solutions. The cool thing about our plans are that even though we're fully insured, actually pretty financially competitive with even level funded right now. So there's a lot of opportunity, and I'm excited to see how we do this year. We are ACA compliant, and like I said, we are a small group, true 50 or fewer employees. A little bit about our benefits. So those of you that already write Friday and have seen this, but love to point this out. And really, this is one of the things that's, kind of sets us apart from competitors. I do see that there's questions. I will be answering these towards the end, and I apologize just for sake of time. So a little bit about our $0 benefits. And so, when they're selling plans, or when they're even just companies are building these plans out and designing them, a lot of people are stuck on the $0 now, right? I've sold these plans as well. People, I'm sure a lot of clients, a lot of people out there just don't really fully understand insurance and how it works. Look at what's my deductible, and what are my copays, and then they kind of walk away. Well, the interesting thing about the deductible is that 80 to 90% of people don't actually meet their deductible. There are a few that do, and it matters, and max out of pocket matters, but for the majority of the population, they don't hit their deductible. And so when we do a lot of testing and polling, what does matter to people? And by and large, people care about what do they pay when they go to the doctor? What are they paying when they go get a test done? What are they paying when they go to? And so what we've done is we've really decided to put our dollars for the average person. And we've known that, having a $0 unlimited PCP is a cool thing. And so not all of our plans, but a majority of our plans have this. We also believe that mental health matters as much as physical health. And so $0 unlimited mental health benefit through our network Sondermind is phenomenal. This could be an in-person or a physical therapist that you see, depending on, who you're with and want to work with. Generic drugs, the majority of our generic drugs are going to be at a $0 copay. We offer an annual eye exam. So we offer an annual eye exam for both adults and pediatrics alike. This is really cool just because a lot of plans don't have this. They may have a dental feature or whatever, but this is a exam, as well as discounts on lenses and frames. And this is through VSP. We do have $0 unlimited teledoc. So that's going to be regular teledoc. I think there's now a mental telemental doc or whatever they call it. So really cool option there. That's really great, especially when you're traveling. I've used it, and they've done a really good job keeping up with everything. And then we always highlight our annual wellness exam. So that's just preventative care. For the ACA, we're required to offer that, but it's really a good thing. So these are the $0 benefits that kind of, I think, set us apart in a lot of other plans. The first dollar benefits matter, right? So from I'd just like to talk about changes because we're pretty new in the market still in Texas, but we did take a significant decrease in premium. And that was really purposeful. A lot of people were shocked because most people only take increases. But we were backing into our rates. We were backing into our network. So as we've been building this network out and kind of getting our rates correct, really make sure that we're not coming in buying business the first year or two, right? That we're actually coming in and being competitive and affordable and being able to maintain. Don't want to have these spikes in rates year over year. Okay. We did increase our plans. We had 5. Now we offer 9 total plans. Looking at our plans in a few minutes, you're like, where are the other ones, Nicole? There aren't any. We have 9. We are not trying to be complicated and have 300 to 1,000 plans. We have 9 plans, and there's going to be at each level. We have a platinum plan that we added for this year with a $250 deductible. We also have a patient requirement from 75% to 50%. So let's talk about our plans. This is probably too small for you to read, but this, and then we do have this in a PDF version. I do send all of these slides out after the webinar. So you will get all of these slides in your inbox, and then you can also the whole brochure. If you don't have any physical brochures, you can also find this online in a PDF. But I'm just going to kind of talk about some highlights here. So the first 4 plans, you notice bronze plans. We've got 2 silver plans, 2 gold plans, and 1 platinum. You'll notice that even at the bronze level, benefits. Okay, so unlimited PCP visits at a bronze level. Guys, I don't know, what you're seeing out there, but I've heard several brokers season, that's really one of our sweet spots. So while we do have this cool platinum plan and we've got some really other great plans, the first dollar benefits at a bronze level for the premium price is getter. So keep this in mind when you're pitching. But you'll notice that PCP visits, the mental health visits, even at a bronze, silver, and gold. I mean, actually, there's going to be copays for prescription medication. I believe, actually, excuse me, silver, gold, and platinum. There's going to be copays for every tier of our prescription. You will notice that, I'll just jump all the way to the platinum. You'll notice on the platinum, $250 deductible, $4,500 max out of pocket. And then you have $0, $20 copay for your specialist visits, $250 emergency room visit, and then copays for all prescription medication. So this plan there. I always tell a story. I was in San Antonio with a broker and his client, and just asked me to come along. I live in Austin, and so if you're ever coming along and talking with you and a client, I'm more than happy to do so. Love being the face of Friday with you and your clients. So anyway, I was with this client and we were talking what they're currently on, and they were currently on a Blue Cross Blue Shield plan, mixture of HMO, PPO, but they were paying for the employees 100%, and they were spending about $100,000 a year, and they were offering them a pretty nice plan. It was like a $1,200 or $1,500, but they were paying $100,000 a year for this coverage. Well, we compared apples to apples, and I pulled out the platinum plan and we looked at it. It was a $250 deductible. We looked at their providers, and I believe all of the providers that they currently saw were in network other than two. And we could platinum plan with a $250 deductible and these $0 benefits, and they would be spending $66,000 a year. And it would be an EPO. So we wouldn't even have to work hassles for those that had those plans. So just to compare, we are substantially cheaper, and those two providers that weren't in network, we actually got them in our network. So pretty to where we sit in the market and what we can do. But yeah, those are our plans. Definitely can dig into those in a bit. So additional benefits, as I mentioned, Teladoc is our 24/7 virtual doctor visit. Dispatch Health. This is really cool. Some of you might have used this in every market. Unfortunately, that has nothing to do with us. They are a partner and an additional benefit. But Dispatch Health is an urgent care that comes to your house. Okay, so it's in Houston and San Antonio. But this is a phenomenal service because you're only paying your copay or whatever that benefit is. Which depending you're on. So if you're, subject to deductible, then it would be a full price until deductible. But, if you're paying $50 for your urgent care on your plan, then that's all for this dispatch, urgent care to come to your house. And they come in full PPE gear. I've heard people say that they've stitched them up. I had someone tell me they did an EKG in their living room, give you a COVID test, a flu shot. Really cool service, especially during the pandemic. We've seen success. If you're on a Friday plan, you should definitely use it. Is our annual eye exam partner. Sondermine is the mental health partner that we use. So if you're not familiar with Sondermine, I definitely advise you to take a look and so forth on our website. But these are wonderful $0 unlimited mental health visits. It is the same, you pick your therapist and you stay with your therapist. So whether they're a virtual visit, really cool service there. And then our national access program is basically that big out of area RAP network. So let's talk a little bit more about what's allowed on our plans, because a lot of these questions come up. We do allow spousal groups. So just to knock that one out, we do allow for both on a plan if they work for the company. So somehow they need to be working for the company, and they would need to show that they receive payment. So not necessarily doesn't have Schedule K1s, but definitely need to show that they work for the company. But we do allow spousal groups. If there's one other employee, we even allow them to be on the site. Okay. We don't limit how many of the plan combinations that you can offer your clients or that the clients can offer out to their so they could have 5 employees and offer all 9 plans if they wanted. I wouldn't advise that because I think that could be very complicated for a company, but you can offer because we do allow for ghost plans as well. Carve outs, guys, we are a small group plan that allows for carve outs. A really cool thing right now, especially when, I think the whole nation is trying to retain employees, but you can carve out for hourly versus salary management, non-manager, non-owner, geographical locations, and there might be one or two others, unions, of course. This is a really cool offer, retail establishments, restaurant businesses who really want to retain maybe management, but it makes more sense for their hourly employees to go get a subsidy, right? To go necessarily, join in on these plans and pay 50%. And so that's a really cool way you can just make, a certain class eligible or non-eligible. And I have all of this in our underwriting guidelines that I'm happy to send along as well if you're interested. 1099s, we do allow for up to 50% to be a 1099. What that means is if you have, 9 out of 10 of the people that you're wanting to offer coverage be a 1099, that wouldn't work. Okay, for 50% of them can be a 1099. They just have to work that minimum 30 hours, like any other full-time W-2 employee would be working. Okay. To live outside of the area, we already covered that. Participation requirement is 50%, and we do accept valid waivers, so that won't count against. And then the contract requirement, that means we do require that 50%, basically the employer needs to pay 50% of the employee only premium each month, or 120 flat rate, whichever is lesser. Okay, so that's minimum outside of the participation holiday. So participation and contribution runs from November 15th through December 15th. And what that means is both of those are lifted. Both participation requirement and contribution requirements don't exist. So you get happy enrolling. And then ghost plans we do allow for as well. As far as getting a quote, I know a lot of you use, so I'll jump and go to option 1. I know a lot of you already use a platform to quote. Feel free to continue to do that. We do have integration with a lot of quoting platforms, one of them yet. But Ease, Benefiter, Zywave, Perfect Quote, and there's a ton more now that we're integrated with. But you can pull quotes from there, or if you want to send it directly to us, you can send us a census. The census is just a basic standard census, name, date of birth, and, kind of family and gender. And we can turn a quote around in 24 to 72 business hours. We try to get them out same day when we're not super busy. You can send us a census as well as the name of the company and a physical address, and we'll get that turned around. You can send that. I prefer you send it to TXSG FridayHealthPlans.com. So definitely record that if you want. You can send it to me. I am currently on vacation despite this webinar. So right, best if you sent it to the TXSG quotes, but our account management team is wonderful. We get those turned around fairly quickly and they come nicely packaged. So feel free to send your quote. Installment is fairly simple. We do not have a broker portal yet on the group side of our company. We are phasing that in. So for those of you sitting and waiting, me too. But as far as installment goes, it is somewhat manual, but I've heard people say that did, group enrollments for 1/1 this year. They were like, wow, selling Blue Cross for 30 years, and this was way easier. So we do try to alleviate some of the headache around it and help you, but they are digital applications. Basically, where to install is simply, we just need to get the employer application, employee applications and waivers, and then just a TWC report. If they don't have a report, we do require that they provide us information like their Schedule K-1s, or if it's a brand new company, we just need to see a couple weeks of payroll or any W-4s for new. We try to keep it pretty simple, but those 3 are really what you need to send in. And then our account management team will be following up to get any other documents or, after they've scrubbed the applications, anything that's okay. All that can be sent to FHP new group. Again, you don't have to remember all of this as you go through each step of the enrollment. We do provide you this information. Okay. As always, you do have my information and I am your go-to, even on vacation. So why Friday? We're competitive. We're in the market and we're competitive on the fully insured side, even level funded sometimes, right? We have 9 simple plans to choose from. We don't want to overcomplicate it. We don't need, we need something for everyone. That is not a HAS plan. That is an HSA plan, but we do offer an HSA plan at a bronze level. We've got, bronze and platinum level plans. We've been very deliberate and consistent year over year, and that really speaks to rates more than anything. But as we're building this product out, we've been very deliberate in how we're doing that, and also hopefully, keeping it affordable and not having to see, show 40% increases at renewals. And then lastly, brokers and members come first. I mean, we really care. Like I said, in the very, very beginning, we treat the small guy like a lot of companies treat the big guy. I want you guys to be treated well. I want you to have what you need. And I want, members to really love Friday as well. So we really try to I don't try to sell direct. We don't want to sell direct on the group side. I really, really want, or either side really, I want you guys to do that work. I want our brokers to sell our plans, and I want to support you. It's a big focal point of where we sit as a company as well. Let's talk a little bit about network. These are going to be some highlights. These are our hospital network regions. I'm looking to see if anything's obsolete yet. We've been growing our network like wildfire. So we have been growing this and need to do so. I just saw a ton of new positions. Basically, what we're doing is we're just building out and expanding in each one of our regions. And we have feet on the streets in each one of these regions, building out our network and getting to know providers and really listening to what the brokers are saying, like, which physician groups matter. And so, they're in the DFW area, kind of general rule of thumb is Medical City and Methodist. We do have, Cook Children's there. I do believe we're looking at, some other conversation. But for right now, that's DFW. San Antonio, we have Methodist and Baptist. So we have tenant contract. When we got Baptist towards the end of last year, tons of new providers, because in each contract, when we have a hospital contract, we credential every single physician that's within that hospital system. Okay, so it's not just the hospital, it's going to be also any physicians attached to that group. In the Rio Grande Valley, we're pretty strong. And I typically just say we have most all hospitals minus the Prime network. Okay, so that's going to be Napa and Mission, I think mostly, but you'll notice that there in county, we've got South Texas Health System, we've got Cornerstone, we've got DHR, we've got the Rio Grande Regional in Cameron, we have Regional Valley Baptist, and Star, we've got Star County, and Webb, we've got Doctors Hospital of Laredo, Nueces Corpus Christi Medical Center. So really building that out. We're really doing well in the Rio Grande Valley. It was our third largest market of sales this year. So in the Houston area, we have HCA. We also have Texas Children's Woman. I will say this, and I say it on every call until we have it, but we are in negotiations with Memorial Hermann. So I know that there is a lot of interest in the system there. So we're looking to do that. It is not finalized. So right now, if you sign anybody up, they do have HCA as an option. Okay. But we do have Texas Children, and that's a bit unique to carriers. In Austin, we have St. David's, Williamson County as well. And then El Paso, we've got Las Palmas del Sol, El Paso Children's, Providence. Over in Lubbock, we've got UMC. All righty. These are some highlights. I'm just going to go through these fairly quickly just because I like people to see. And this is since 2021, the beginning of 2021, we grew actually probably more like 50-60% in DFW. And you'll just notice that we've listened to our brokers and we've added a lot of the different hospital groups. A lot of the physician groups that they requested or nominated with a nomination process. And basically that just means you email us over the name of a doctor or physician group, and it gets to our network. They recruit them and get them in our system and contract them. And it takes about 30 to 60 days on average. A lot of times they get held up at the doctors needing to review the contract or whatnot, but do a really good job converting them. So I definitely encourage you, if you know of anybody, to send them our way, and we do a really good job along the way. So if you know you've got a renewal coming up in April, but this one doctor is a make or break for them to move, give it to us now, and we can work to get them in our network. So on materials, so that's it about network. I'm sure there's a lot of questions. I'm going to dive into the chats here in a minute. But when it comes to materials, like that brochure that I was showing under mine, like some of our partners, SBCs, EOCs, everything can be found on our website. If you go into our website and just go to fridayhealthplans.com, under you're going to access something called sales materials. Under sales materials is everything you need. So brochures, applications, the formulary. You don't need a login to get, so feel free to dig in there. Let me know if there's anything on there that anything else that you might need that you don't find on there. I can see if I can get it for you. And we do have an app. So this came in handy when the USPS slowed down substantially and we sent out member ID cards. So our app is wonderful. I use it, shows everything you need. So definitely if when you're enrolling people, let them know that to download the app and start using that. It'll show their member ID information, receiving their card in the mail. Wellness information, all sorts of discounts, guys. If you want to dig into those, I'll let you do that on your time, but definitely all sorts of wellness. We're constantly enhancing our technology. So on the group side as well, we're just wanting to phase in more and more, group portal to make everything accessible for you. So just keep that in mind as we're growing. Here's a few of our broker support. We are in the process of hiring, I don't know, close to ways this year. So everything's growing like a wildfire in our company, but we do have a wonderful broker support unit. They can help with appointment questions, claims questions, provider networking. So anytime you can't find me, feel free to reach out to broker support. They're very knowledgeable. Sometimes you'll ask me questions and I need their help. So you need between me and broker support, we'll be able to help you out here. Customer success is called Care Crew at our company. And this is the information to access the care members would be accessing to find out information about their coverage. Here's my information. If you don't have it, definitely write it down. This is my cell and my email. As I mentioned, I am on vacation right now, so I will not be responding today if you reach out to me outside of this webinar. But feel free to reach out. I believe if you need anything, Kylie Everhart is there to help right now. I will be back on Monday. So if you want to schedule some time to chat, love to meet you. A lot of you on this call, but if I've not met you yet and you're one of our markets, and love to just discuss how I can help and be a support to you. So feel free to take my son. And kind of what we ask, the role of you as the broker is to sell our plans, right? To sell our plans and then to advocate for your clients. We always talk about the right product for their needs. And so we understand that, not everybody's going to need the same thing, but we really trust you that you're going to find the most right product. I mean, we don't want churn as much as you don't change clients over and over again. So the better you do it, kind of advocating for them, the better we all are. And then sharing feedback. This is really important. I always ask that people feedback as we're going along this journey and being a new, very strong presence in Texas. I ask that you, as you're quoting us, as you're enrolling, please provide feedback. I'd love to know the areas that we can improve and also the areas that we're doing really well, because those are testimonies to just what we're really trying to accomplish. We do a broker trip every year. This was last year. They took everybody to Vail, but everybody is in the top performers. So there is a top performer broker trip. And this year it's going to be in Seaside, Georgia, I believe. It's in the tropics, so it's definitely more of a tropical than it is the mountains of Vail. But we do really value what you guys do. There are lots of broker bonuses, even though I'd love to share with you. So let's get offline and I can share the details to how those broker bonuses work. But if you want to write those down, even I guess I could just share those. If you write them down, they are paid out quarterly. So along with the 5% commission that we pay out, we do offer bonuses per quarter. If you groups, we pay a $250 bonus on each group, new group. If you sell 6 to 10 in a given quarter, we're going to pay $450 per group. If sell 11 plus in a given quarter, we're going to pay $650 per group in addition to your commission. So could be quite a lot of money that you can make getting new groups on with Friday. That book, Let's Talk. But that's all I have for today. I'm going to look at our questions here. I think there's quite a few questions we have. So feel free to chat here. Though contracted, not available in the Cameron County area yet. We are in Cameron County, Marco. Are in Cameron County. Definitely are.
Finding it difficult to get a hold of doctors that are taking the plan. That's why
Okay. Well, Marco, if there are certain physicians, we are still growing that. If there are certain physicians and certain doctors that are maybe not familiar, that you're like, hey, new insurance company, if you can, even if it's a list that you have, if you know certain provider groups, send them to me. You can feel free to email them to me. I'll get them to our network team and they can go. I mean, we contract pretty easily. They're just a lot. I mean, there's a lot out there, right? There's a lot of providers and we still are becoming familiar. So,
all right.
So
Thank you.
Absolutely. I mean, my experience there in the Valley is doctors are interested in wanting to get on. It just takes them a little bit, right? So obviously, as more and more members are, going to be using Friday, doctors are going to want to, contract with us. So definitely send those names along. Have another question. Oh, have a broker that cannot attend. Can I record it? Send him a link. Yes, Howard, if you didn't record it, I had no problem if you did want to record it, but I'm also going to these slides. And if you want to have I do these every Thursday at 11 o'clock. As I said, last week, there was a bit of an issue with travel, but every Thursday at 11 o'clock, I like to do it myself. And so that's why I'm here today, even on vacation. No cap either. Daniel, I'm not sure what you're talking to around cap. If you want to go in a little bit further. If I get a group, I do the demographics and pass the information to Friday. You take over from there. Comes to quoting, Marco, that is correct. So if you want to send us the census, the name of the company and the physical address of the company, we do quote it. We send you the quote, but we don't necessarily take over with a client relationship, but we do get you the quote. We get you all of the applications and everything you need to client. And then from there, if they're interested in enrolling, you go ahead and get those applications filled out and send those over to us. And then our account management team would go scrubbing and the enrollment process. And so once it's approved, they do notify you and your client that the group is approved, and kind of a timeline on when they would receive those and binder payment information and so forth. But yes, so we kind of work in tandem with you in getting that group stood up. Marco, you asked about specialists. But how about specialists?
I see that on the benefits, unlimited trips to the doctor. Specialists are covered, I'm sure.
Yeah, so specialists, how that works, or specialists. So if you look on that plan brochure again, or the SBCs, depending on that plan, could offer a specialist copay at $80, $60, $20, depending on the plan. Some of the plans are subject to deductible, and so there's not maybe a special pay. It would be subject to the co-insurance. Okay, so depending on the plan, you could be able to see a specialist with a copay listed. It could be that you pay full price until your deductible is met.
Thanks.
Absolutely. Okay, another question. Suzanne said, would like underwriting guidelines. Yes, absolutely. And yes, if you have a client, sorry, that was a private message, feel free to send that. I cannot record these chat messages. Definitely, if you didn't, I'll go ahead and pull up my information again. Please email me, or if you want to email that Texas SG quotes, let me get back there. So this email address, they can turn around that quote very quickly. So if you're interested in getting information, feel free to reach out to me. If you're just wanting to get a quote, it's txsgquotes@fridayhealthplans.com. But yes, absolutely happy to talk with you. As I mentioned, I am not in office today, despite this webinar. I will be back on Monday. So if you want to talk to me, I would have to wait till Monday. Please send me an email, if you're interested and want to set up a time. Is the provider network the same as ACA network? Daniel asked. Yes, it is. So if you're already selling and you know that you're familiar with our network on the individual side, it is the same exact network. Okay, so we do share the network, entire company, all of our plans, individual and small group alike, are EPOs, and we all share the same network. With the exception that we offer on the group side, the works for the 30% of employees that do live outside the area. Okay, so we do offer a little bit more robust network outside that area. Awesome to hear. Zamba said that broker support has been very good on the individual side. Well, I hope they would be very good on the group side as well. I think it would be the same because they are the same people, just different product. So thank you for that feedback, Suzanne. Is the provider network the same as ACA network? Yes, Sarah, as we mentioned, or Sarai, as we mentioned earlier, that is the same network. How long does it take to get a provider on the network, more or less? So Daniel, from anywhere from 30 to 60 days. Sooner you get us the information of a provider you're wanting to nominate, take as little as 30 or a couple weeks to 30 days. It could take as long as 60 days if a provider sits on the contract that we provided or is not accessible. Sometimes if we have a client or a member that's really interested in getting a certain doctor in our network, I always say, if we'll reach out to them, if they're not, reach out to them if you have that relationship. I know networking loves that. Kind of going at from both sides if we're eager to get someone specific in. Navid, you're raising your hand. I believe.
Yes, Nicole. I want to ask that, see the page we are seeing it right now. So
Yes,
on these platforms like Ease and Perfect Coding, so that also give us a similar code as Friday.
that's correct. Yeah, I believe that all of our platforms allow for both composite and age banded. So they would be able to pull a quote, and that's we have an actual integration. So as long as they're integrated, as long as you can find us on there, if you're with Benefit Mall, they have a quoting tool, but we should be able to be in there. So yes, you would be able to see the same quote. And so that's up to you on just how you want to receive your quote. You can use one of these, or if you want to get that directly, that's one, you can send that to us directly. It doesn't make any difference to me, how you want to use it. I mean, obviously enrollments will also come through us. So when it comes down to the enrollments, that you're not going to be able to enroll through one of these just yet. I am looking at like Employee Navigator and some of these other platforms for us to start doing our enrollments through. But as of right now, Quota enrollments happen through emailing with us.
Through, okay, that's good. And one more thing.
Mhm.
Like we are doing small group insurance, right? Less
Sure.
than 50 and fewer. And two and more, but they got to be full company.
Well, so great question. So minimum of 2 employees, we are at 50% participation. So you could have down to, if you had, I'll give a couple scenarios, maybe that would help. So if you have 2 employees, if one chooses the coverage, let's say that one doesn't have neither have valid chooses, one doesn't choose, we could enroll that one person in the group plan. Okay. So up to 50 employees. When it comes to part-time, it doesn't really matter. That's not part of our conditions. We just, per TDI, per the Texas Department of Insurance, in order to qualify for group health, you have to work at least a minimum of 30 hours. Okay, so as long as you're meeting that requirement of 30 or 40 hours a week, then that employee would be eligible. The requirement as a whole. And then even further, you can decide, or the employer can decide, if they want to carve out and say, anybody that's employee is going to be getting coverage, but any hourly employees we're not offering coverage to. So even if they're making, even if they're working 30 hours a week and they're part-time, 30 hours a week there, or I guess, basically however you want to carve that out, we just can't discriminate according to, the different classes. So there's 4 different ways in our underwriting guidelines. Does that kind of answer your question?
Yes, I pretty much understand it. And correct me if I'm wrong, if I get it right or not. So in my office, we have 5 people, right? Including me and 4 more.
Yes.
So they all working 30 hours and more.
Okay.
Right? As an employer, I can enroll them on the plan, but if they choose not, but at least 2 people chooses to enroll on that plan, they can do it.
50%.
Yes. So if
as long
2
as it
don't
makes 50%.
want that plan, but if 2 can get it enrolled.
Yes, if they'd have no valid waivers. If they have a valid waiver, then 4 out of the 5 could not enroll. If they have a valid waiver, it wouldn't count against them. So that's correct.
Okay.
Awesome. Okay, another question. Let's see here. Do you administer ICRA or how does Armando? Great question. So we're not the ICRA administrator. We do work with a couple companies, or I know a couple companies that we can kind of point you to. We are not the ICRA administrator. I do know ICRA, so I'm more than happy to talk through that on another day. But ICRA is a great option, especially if they're not looking for the traditional group insurance or employees that were able to serve over 50. So ICRA would be a great option for some. I'm happy to talk about that. We do not administrate. Okay, so if you're looking for ICRA, individual plans that would be available for an ICRA, but we don't do the administration. So I think I might hold a webinar at some point on ICRA, but I'm not. Is there underwriting in group? No, it is a guaranteed issue. So that means there are no questionnaires. So is it open enrollment with pre-existing health issues? Not a problem. Pre-existing issues are never a problem. So there are no questionnaires at any point. I mean, very sick people on the plans. You could have people that, are all healthy. We don't look at pre-existing. Okay.
Thank you.
You're welcome. Linus said, can we have an agent website to send clients to enroll themselves? We currently do not have any landing pages That is a great idea. I would love that. But we do not currently have any which way for there to be a link for the clients to enroll themselves. And I think that's fairly standard for group. I think they're typically on the group side. If you're Linus, if you're used to selling individual, that makes a lot of sense. On the group side, typically there's a little bit more hands-on approach as a whole. So you would need to be more involved in that enrollment. But so far that I believe we've caught up with the questions. Does anybody else have anything else that they're wanting to understand or need some clarification on before we get on? Group portal. No, Daniel, there's not a group portal. Unfortunately, right now, there's only the individual. We do not have the group portal, but we do send out weekly business. We do send out, commission reports and so forth. So we do not currently have a portal. We will be getting one. I do not have a date on that. I can't wait for it, but I'm going to be a little bit more manual. So just to be transparent there. Wonderful. Thank you, Marco, so much. I appreciate everybody joining today. Thank you so much for spending your 30. I hope this was helpful. I cannot wait to get some censuses in. As I mentioned, I will be sending these slides along with some other information out. So feel free to start sending us your clients. Love to meet you if I haven't yet. So let's schedule a time. Thank you and have a wonderful day.
Bye-bye.
And I will because I'm in Hawaii. See ya. Bye, guys.
you.